We're excited today to have Juliet Bui from the Department of Health and Human Services join us for speaker session 14. Juliet is with the Office of Minority Health, and she leads policy and data related efforts to supply the development of health policies and initiatives to reduce health disparities and advance health equity. So this is in sync with our mission. We've got folks on our team developing strategies to determine how we get the right public health information to at-risk communities. So Juliet, thank you for joining us today, and I'll turn things over to you.
Thanks so much, John, and thanks so much for the invitation to join you today. Good afternoon, everyone. I hope you're all doing well, and I'm so grateful to be here on behalf of the HHS Office of Minority Health to share about our office and some of our work to support culturally and linguistically appropriate services. It's a real honor to connect with you today, and I really think the work that you're doing through Unity Bands to support healthcare workers and to ensure that vital public health information gets out to the communities at greatest risk is truly inspiring. And I sincerely hope that the information and resources that I share with you today will be helpful in your work. So as we get started, I'm just curious how many of you have heard of the Office of Minority Health. I'll just start with a real brief introduction of our office. OMH's mission is to improve the health of racial and ethnic minority populations through the development of health policies and programs that eliminate health disparities. So as John said, like Unity Bands, our focus is on underserved populations, underserved communities who are at greatest risk for or are experiencing health disparities like higher prevalence of health conditions, worse health outcomes, or poor access to quality care. OMH is an office within the U.S. Department of Health and Human Services, but we're not like some of the larger agencies that you've probably heard of, like the CDC, FDA, or CMS, but we do work with agencies across the department on minority health efforts. Also, while we don't provide direct clinical services, we aim to support the success, sustainability, and spread of health disparity reducing policies, programs, and practices by supporting efforts to identify and share what works. And we do this through a variety of ways, including funding demonstration grants to test interventions, by convening partners, and by disseminating information related to minority health. One of OMH's priorities is promoting cultural competency among health professionals and at health organizations. So today I want to share about that work and highlight some information and resources that I hope will be helpful in your work to share public health information in the community. So as we dig a little bit deeper into this, I'd love to hear more from you about the communities you serve. So if you'd like to drop in the chat box, or again, feel free to unmute to share a bit about the demographics of the communities you work with. I'll just pause as folks may be typing and keep an eye on the chat box here. Thanks, John. So low-income healthcare workers in the DMV area and in New York. So just in the DMV area alone, we know it's a very diverse population, and our communities are comprised of a diverse range of individuals who communicate in different ways and understand health in different ways. So that's why OMH promotes culturally and linguistically appropriate services, or CLAS, in health and healthcare efforts. And we define CLAS as services that are respectful of and responsive to individual cultural health beliefs and practices, preferred languages, health literacy levels, and communication needs. So how we deliver healthcare and how we deliver health information should really take into consideration each individual's culture, language, and preferences. We also believe that everyone has a role in providing class, not just doctors, nurses, or other healthcare practitioners that may be providing direct care, but also folks like healthcare administrators, receptionists, health educators, and anyone who's involved at any point in this very broad spectrum of health and healthcare. And thanks for the additional chat message here on homeless populations of all ethnicities in Detroit Metro. So providing class can result in a number of positive outcomes. Meeting the needs of the populations we serve contributes to improved access to care and quality of care and services. And we see this through a number of outcomes like increased individual and family engagement, increased use of services, and increased adherence to treatment. And many of these outcomes are really driven by improved communication. So for example, when a patient's language needs and preferences are met, there's less of a risk for miscommunication between a provider and the patient. There's less risk for misdiagnoses and a greater understanding by the patient on the treatment plan. And I'd also like to highlight that class advances equity. For example, as we saw throughout the COVID-19 pandemic, some communities were being disproportionately impacted by COVID-19. And the lack of class played a role in contributing to barriers and poor outcomes and perpetuating inequities. So to help organizations and professionals with operationalizing class, OMH developed the National Standards for Culturally and Linguistically Appropriate Services in Health and Healthcare, or the National Class Standards. There are 15 standards, each of which is an action item that guides professionals and organizations in providing services that are respectful, understandable, effective, and equitable. The class standards are structured to include a principal standard, which you'll see in this box on the right-hand side of the slide, which serves as a foundation for all of the other standards. And the standards fall under 3 themes. The first theme being governance, leadership, and workforce. And this theme emphasizes that implementing class is the responsibility of the entire health system, and it really requires the investment, support, and training of all individuals within an organization. The second theme is communication and language assistance. And this theme encompasses all communication needs and services, inclusive of languages other than English, sign language, Braille, oral interpretation, and written translation. And then finally, the third theme is engagement, continuous improvement, and accountability. And this theme focuses on all those supports that are necessary for adoption, implementation, and maintenance of culturally and linguistically appropriate policies and services. Now, given the focus of your work in sharing public health information, I'd like to focus on the communication and language assistance theme. The 4 standards under this theme focus on the provision of no-cost, timely language assistance to individuals who have limited English proficiency or other communication needs. Notification to individuals that these assistance services are available. It ensures the competency of individuals that provide assistance, like interpreters and translators, and also the provision of easy to understand and in-language materials and signage. So thinking about where you get healthcare or where you provide healthcare if you're a practitioner, In what ways do these settings provide assistance that meet these standards? And feel free to share in the chat box.
Juliet, while we're going through this exercise, I do have a question. Like, so considering Unity Bands is a small, relatively new nonprofit, how do nonprofits measure these standards?
Yeah, it's a great question. I think the starting point is in assessing at an organizational level what strategies the organization might already be using aligned with each of the 15 standards. Well, really maybe 14, because the principal standard is an overarching standard. And perhaps doing a kind of gap analysis to see where there are standards where there aren't strategies being implemented or where things could potentially be improved. We have intended the standards to be a flexible framework for a variety of different kinds of health and healthcare organizations. So we understand that this ranges everywhere from smaller nonprofits like Unity Bands all the way up to massive health systems that have, networks of hospitals and clinics engaged and potentially more resources. So I think, like I said, it starts with a bit of strategic planning and thinking about where resources exist to implement strategies associated with these standards, depending on what's feasible for the organization. And then, of course, I think part of your question too, if it might be associated with thinking about a feedback loop for quality improvement, where an organization might think about some metrics by which they can check in on a regular basis on how well they're doing on implementing the strategies and whether they are effective in improving the provision of class, whether that be in providing in language materials, making sure there's connections to interpreters, or collecting data on race, ethnicity, and language.
Great, thank you.
Yeah, you're welcome. Thanks for that question. All right, so let me move on here. So just speaking of general strategies, there are some pretty obvious things to do aligned with the standards themselves for how organizations can implement these particular standards, like offering interpreters to individuals who have limited English proficiency at no cost, making sure that interpreters are qualified, and providing materials like brochures, forms, signage in languages other than English. Okay, so dropping down from sort of the organizational level, let's talk about the work that you do in sharing public health information and communicating with folks in your community. What are some skills that you use to support effective cross-cultural communication? And let me know if you've done any of these things in your work to share public health information, or these are resonating with you. One, becoming knowledgeable about the backgrounds of the individuals you serve. Being aware of language differences and offering language assistance services. Building trust and rapport with the individuals you serve to facilitate that learning about their needs, values, and preferences so you can tailor the way that you're communicating to those needs, values, and preferences. Using simple language, so avoiding medical and healthcare jargon, and not making any assumptions about an individual's literacy and health literacy levels. And also checking understanding and encouraging questions, not assuming that an individual has understood what you've communicated. And thanks for the comment here in the chat here about respect of cultural differences is key. Yes, very much agreed. And can be a challenge. I don't know if you're in a place where you can unmute and maybe share a little bit more about the challenges here of making sure that we're respectful of cultural differences.
We have a large Arabic population, and culturally, when dealing with families whose women are are prized differently, becomes a challenge when when attempting to provide services, when you have to go through their males, when women and children don't have access to the services that they need due to the language barriers and or cultural constraints.
Yeah, thanks very much for sharing that experience. Those kinds of cultural nuances are really important to understand, and sometimes, as you said, can pose challenges to making sure communication is happening clearly. I'm curious if there's been what steps have been taken to navigate that, given we want to be respectful of folks' culture.
It has been effective in some cases to have the males speak with males, separate the women to speak only with women, and within eyeshot and earshot of the males that are responsible for them. It's difficult sometimes to get that private one-on-one communication in order to clearly understand what's happening, what the needs are, and where the client might not be able to express themselves freely. Yeah, so that's been a bit of a challenge and continues to be a challenge.
Yeah, I appreciate you sharing that. I'm glad that there's been some approaches that have worked, and can appreciate that sometimes there's not really an easy answer when navigating these cultural differences. But I think ensuring that that there's a baseline and understanding where what the cultural preferences are, what the values are, and what the needs are, and then trying out some things and working with patients to see how things can improve, I think is a good first step, and maybe a good first couple of steps while the provider is working with patients. So thank you for sharing that. I'm gonna pivot now to sharing about some of OMH's resources that I hope can be helpful to you, and I invite you to check them out. OMH provides resources to support health organizations and health professionals in developing their capacity to implement the national class standards and provide class. Think Cultural Health is our primary website that houses class resources like guides and e-learning programs. So you can read more about the 15 class standards. You can explore documents in our resource library. And the site also has a tracking class map that provides information for each state and territory about their cultural competency training requirements. Just to share a bit more about the e-learning programs, we offer a suite of free e-learning programs for a variety of types of health professionals. They're grounded in the national class standards, and they're designed to equip health professionals and students with the knowledge and skills to serve diverse individuals and improve quality of care. These e-learning programs are interactive and self-paced. And they're also accredited, so folks who would like to can earn continuing education units. They're completely free as well. 2 e-learning programs that may be of interest to you are the Guide to Providing Effective Communication and Language Assistance Services, which is designed to help health organizations communicate in a way that considers the cultural health literacy and language needs of patients. And then there's also an e-learning program for community health workers and promotores de salud on how to promote individual level and community level changes toward good health. So you can find those e-learning programs on the Think Cultural Health website. In the Think Cultural Health resource library, you'll also find resources to support the implementation of the national class standards, including an implementation checklist. To your earlier question, John, about how organizations assess, this tool could be something to start with. Specific to communication, the resource library offers a checklist on effective cross-cultural communication skills, some of which we reviewed today. There's also a guide for developing culturally appropriate materials, and a guide for culturally and linguistically appropriate communication during emergencies and disasters. And we developed that in the wake of the COVID-19 pandemic, but it's also applicable in other public health emergency and disaster situations. I'd also like to put in a plug for a CDC resource. CDC offers health equity guiding principles for inclusive communication. These principles are intended to help ensure that communication products and strategies adapt to the specific cultural, linguistic, environmental, and historical situation of each population or audience of focus. So I will drop a link to those principles in the chat here. And then finally, I want to share more places where you can find information from OMH. We share health information and resources through our website, minorityhealth.hhs.gov, through social media like Facebook, X, and Instagram. We also have recordings on YouTube. And I invite you to use this information to share with your communities. I'd also like to invite you to subscribe to our weekly FYI newsletter and monthly health equity newsletter. And you can subscribe by visiting our website. We also have an OMH resource center, and you can reach out to the Knowledge Center within that resource center to request information. So for example, the Knowledge Center maintains a digital library of minority health journal articles and other resources.
We run a referral service, and one of the challenges, again, is to get the information, to find out what a person needs initially in a private setting. Sometimes can be a challenge. And then moving on to service provision, it's very difficult to be able to determine where the person might be best served. Just because a particular organization offers a service does not mean that they are appropriate for a specific client. Do you have any thoughts or feelings, suggestions about how to navigate that landscape? it's been a challenge.
Yeah, it's a great question, and it's an area that takes some planning and execution. Um, what we've heard from different organizations who we work with or are funded is that there needs to be a concerted effort, one, to understand the needs of the community. So who are we serving? What are their demographics? What are their language needs? What are their health needs? And tailor interventions accordingly. So a lot of what OMH funds are demonstration projects where there may be this evidence-based intervention that's had some evidence of effectiveness for a general population, and then the awardee will make some adjustments to that intervention to make it more culturally appropriate, and then test its effectiveness in their community. So I think the science is growing in regard to practices and interventions that work for different populations. I guess this is an opportunity for me to put in a plug for a brand new resource that we're working with NIH on. NIH, of course, funds a lot of research on health, including similar research on what helps to address minority health disparities. They've recently launched a website called HD Pulse. HD Pulse has two portals, one portal that provides access to data and another portal that provides access to interventions. So it's brand new. The interventions portal, it will be a place where folks can find different interventions that are focused on different health issues, focused on different populations. So hopefully if a community or a researcher goes to this portal, they can potentially find an intervention that they could replicate or try for their community. So that is one resource.
Great question. Last call, anybody in the group here? Okay, Juliet, nothing else heard. From the Unity Bands team, thank you for doing the prep work that went into today and hosting this session. I really appreciated the dialogue that was going on. So this was a great session. Thank you.
Oh, absolutely. Thank you very much again for having me. I hope it was helpful. And my email address is here on the screen. I welcome anyone reaching out to me if you have any other questions.
Great, thanks again. I had a couple quick notes for those on the call before we break for the day. For starters, if you're joining us for the first time and you're not familiar with Unity Bands, we are a nonprofit 501c3 based out of Annapolis, Maryland. But as mentioned earlier, we really kind of have the dual purpose mission. One, we discussed a little bit. Two is to support low-income healthcare workers. And we do that in the DC, Maryland, Virginia area. We do that up in New York City as well. One of the programs that we have is this monthly speaker series. So we currently do not have one scheduled for October, but we do have one scheduled for November. So on November 25th, we have Dr. Jacoby Wilson joining us. And Dr. Wilson is a professor with the Department of Global Environmental and Occupational Health and Department of Epidemiology and Biostatistics, University of Maryland, College Park. So he's joining us on Monday, November 25th. We'll probably do that at the 8 p.m. Eastern time. So with that, I think those were the only announcements that I had to wrap things up. But appreciate everybody taking a few minutes out of their busy day to join us, and have a great day.